I want to talk to you a little bit today about the Medicare Orthotics and Prosthetics Patient-Centered Care Act. This has been a legislative priority for AOPA for several years now, and we are actively moving the bill through both houses of Congress, both the House and the Senate, with bicameral, bipartisan introduction back in July of 2025. There are three main provisions in the bill. The first provision would ban drop shipping of anything other than truly off-the-shelf orthoses. This is designed to prevent fraud and abuse, which has been in the headlines so much over the recent years. One of the ways that folks that are bad operators and criminal elements take advantage of the Medicare program is through schemes where they set up hotlines, where they invite patients to call in toll-free numbers and receive a pain-relieving neck or back brace at little or no cost to you. We've all heard the ads. Next thing you know, patients are receiving 5, 6, sometimes 7 braces on their doorstep. No instructions, no idea how to fit them, no idea if they're actually valuable for their use or not. What this provision would do is that this would eliminate that ability of these criminal elements to take advantage of holes and vulnerabilities within the Medicare program by simply not allowing them to deliver anything that requires actual patient care to a Medicare beneficiary without that patient care being provided by a properly trained, educated, and licensed orthotic and prosthetic professional. Second main provision of the bill is one that would extend the current and existing exemption from competitive bidding to include certified and/or licensed orthotists and prosthetists. Currently, this exemption exists for physicians and other allied healthcare practitioners such as physical and occupational therapists who are providing orthotic and prosthetic care to their patients within the scope of their own practice. Orthotists and prosthetists are allied health professionals, and we believe that this exemption should be extended to include orthotists and prosthetists. So the bill would extend that provision to include certified licensed orthotists and prosthetists. There's no financial benefit to the practitioner, to the O&P company at all. They would still be subject to the rates that are set through the competitive bidding program. The only difference is that they would not have to hold an active competitive bidding contract in order to provide that service. The final provision of the bill is one that would extend and would create or eliminate the 5-year useful lifetime that currently exists in Medicare for custom fit and custom fabricated orthoses. This is important because Medicare arbitrary rules should not be defining how long an item should last. It should be determined by the patient's physician and their orthotist or prosthetist. This is a provision that was created for prosthetics back as part of the BIPA 2000 legislation. This would simply extend that reasonable useful lifetime default, reasonable useful lifetime. It would eliminate it for orthoses as well, and would tie replacement of an orthosis to the physician's prescription and the medical necessity that establishes the need for that replacement. Hopefully that's helpful information about what our bill is, what it means, and what it will do for the patients that you serve. Thanks.